This is how we get around. It's not an ambulance we'd recognise as home. We're bouncing around in the back of a pickup truck in the hours between medical centres. Roads are rough tracks, unfinished or long empty highways, for only the very wealthy can drive. People walk or cycle for miles to get the medicines we take for granted.
It's the basic medicines that we're dealing with, and if we can keep sending them the basic medicines, we can make a difference.
That includes painkillers we pay pennies for. Pills which would cost a day's pay for most in Malawi, where life expectancy is 40.
Our lives, in a way, are about novelty and stimulation, and here it's about survival. And we shouldn't forget we're in one of the poorest countries in the world here.
So any medicines they can get are not going to be wasted in Malawi.
Thank you very much.
Thank you.
It's great.
Right then.
Take good care of it. Bye.
John Graham is a volunteer collecting returned unused drugs from doctors' surgeries in Loughborough. Over 1,000 surgeries now help Intercare.
It's a very slick operation. The medicines that go out are clearly ones that are needed in each clinic. They use them, they know they use them, and they save lives.
Darkness comes rapidly in Africa. Our first medical centre is Nazama. It's in the south of the country near the Mozambique border.
We've sort of given up on this one and we'll do tomorrow morning.
Right.
Because they haven't got any electricity in there.
There's a power cut. There's a power cut most days.
Why do you get more patients in October, November,
It's
December?
because of rainy season.
The rainy season?
Yeah.
And you get more malaria then?
Yeah,
do you?
yeah.
We use the camera light to look around.
It's a bit different to a labour ward in the UK.
We find 3 women about to give birth. 2 have walked from Mozambique.
The quilt's made by the Cosby Quilters, and the teddy bears are donated by Lutterworth Rotary Club.
And these ladies will give birth in the next day or two?
Yeah.
Yeah.
They started already laboring.
A warehouse near Leicester is the hub for Intercare, crammed with rescued drug supplies, staffed with volunteers including pharmacists and doctors. A charity which exists because a couple of Leicester GPs back in the 70s realised how stupid it is to throw usable drugs away.
It is a crying shame because the need is as great as ever in Africa and in the third world generally. And here we are in England, not looking at this subject very closely to see whether we can be of use to other peoples in great need.
Intercare sends drugs direct to clinics in 6 of Africa's poorest countries.
So this is Malawi bound?
Yes.
Direct means posted to an individual so they know they arrive. Some walk 45 kilometres to be treated at this clinic. Alan and Carol have stuffed their cases with teddies and quilts for babies born here, small luxuries at a place with great need. The purpose of the visit is to assess if the right drugs are being sent.
What would it be like if you didn't get that assistance?
Then really it's disaster. Because if you visit the hospital, you'll see how people are coming. So if you don't have those medicines, then people will just stay at home. They will die.
They use this kangaroo method where the mum keeps it close to her all the time instead of putting them in an incubator because they haven't got an incubator.
The quilts and teddies for the newborns go quickly. Not everyone can get one.
But isn't that symbolic of the whole thing?
Well, it is, yes, but it doesn't necessarily make it any easier when you realise that you've handed it all out and there's still one that hasn't got anything.
We head north to Malawi's second city, Blantyre. Nearby is St Joseph's at Limby. It's a big hospital. Unsurprisingly, they don't have enough drugs.
Do you also do them for outpatients, do prescriptions for outpatients?
Yeah, the outpatients department. We have a dispensary.
The mother was done a nutritional assessment and they said...
This mother is low on energy and sucking on nut solution. Her baby is tiny, perhaps too tiny, we're told, to survive.
It's heartbreaking. I have found myself in tears many times in Africa, and situations like that little baby, yes, they bring me to tears on a regular basis.
Akala George.
Even in less rural areas, poor nutrition, malaria and AIDS all contribute to a high mortality rate among children.
The need, I think, is apparent anyway. It's apparent to everywhere. Just because one's a lot bigger than the other and offers a much more wide degree of services doesn't in any way mean that they're both not catering to very real needs.
Another day bouncing down the dusty road, this time to the isolated Namulenga.
Welcome.
Hello, how are you?
Fine, and you?
Here, there's a small medical centre awaiting a rush of patients when the rainy season starts and malaria strikes.
Do they give you any money for drugs? For medicines?
No.
There's a community here, a school, and always new life. Back in Leicestershire, and Intercare volunteers are reporting themselves really.
This is the highest award given to volunteer groups across the UK.
Their work has been recognised with the Queen's Award for Volunteering.
It's just wonderful that we can help so many people who are in such need out there and who really have no opportunity of getting these drugs and medicine and so on, and so it's fantastic.
It's a powerful welcome from the orphans at Mulanje. There are over 800,000 orphans in Malawi, many a consequence of AIDS. At this place, there is no government help for the sick.
I wish the Intercare all the best because they have saved our lives. They have saved our lives. So Intercare, you have to keep it up. Intercare should keep it up.
Alan and Carol spent 2 weeks on the road visiting the hospitals and medical centres Intercare supply with vital drugs.
In our catchment area is 11,000.
They were able to see what was needed and in some places what wasn't. The important thing is to get the drugs used.
This is very important, this is very important, this is very important. We need it.
Intercare's sending more medicines than ever before. Over 38 years we've sent £10 million worth.
Most of the charity's costs are postage, the certain way of making sure the supplies arrive. Yet Intercare only uses a fraction of the medicines we as a nation burn in incinerators or bury in landfill, while others remain without.
The need is very dramatic, and we can do all we can, but we can do so much more if we get some more money into funders.